Hi, everyone. I'm Sarah Johnson. I'm a research specialist here at EWA. Thank you for joining us for this webinar titled, But is it safe to open schools? Public health experts weigh in. Before we begin, let me go over some housekeeping items. If you have a question for our speakers, type them into the questions box in the GoToWebinar control panel. Include your name and affiliation when you ask your question, and please ask your question at any time, and we will get to them during the Q&A at the end. As soon as the webinar closes, you will see an evaluation survey. Please complete it. Your feedback is important and helps us improve. Our moderator today is Melissa Taboda, an education reporter at the Austin American-Statesman. I'm going to hand it over to Melissa to introduce today's speakers and get us started. Go ahead, Melissa.
Thanks so much. Well, good afternoon, everyone. Today we are joined by Dr. Tina Tan of Northwestern University and Dr. Sarah Johnson of Johns Hopkins University. Hello, ladies. So I'm just going to jump right in. As education journalists, this is the hot topic, going back to school. Some school districts already have opened across the country, and others are preparing to open. And already we are starting to see some cases and some students having to quarantine. I think I saw an article today about 900 and some plus students and staff having to quarantine, shortly after their opening. So the big question is, how safe is safe enough for schools in the U.S. to open?
So I think that's a great question. And one of the major factors that has to be taken into consideration before school opens is what the rate of COVID-19 infection is in the community. If you have high rates of COVID-19 infection in the community, it's probably not a good idea to open schools at that time, because you're having an influx of individuals from all different areas of a city or a county, and you're just increasing the risk of these individuals who may be infected to transmit COVID to other individuals. The number that has really been put out there by the World Health Organization, the CDC, and other organizations is a positivity test rate of around 5%. Anything above that is really considered to have significant amount of COVID in the community. And if your test positivity rate is above that, schools probably should reconsider opening so that you give yourself the best chance of not bringing COVID into the school setting and increasing the transmission among students and teachers.
Dr. Johnson, do you want to add anything?
Absolutely. I think that's exactly the point, is that we're really trying to distinguish what's happening in the community and what parts of transmission might be happening inside a school building that are coming from folks just coming to school with COVID, as opposed to accelerating transmission, or schools being a setting in which a lot of transmission happens, where it's not being brought in, people are being exposed to new people at school. So I think what we're trying to do is to create a situation and a condition in which community transmission is as low as possible, so that we can protect those relationships and networks once kids and teachers and other staff get into the building.
So with the return of school, do you anticipate new viral transmissions?
We know that that's definitely a possibility. Schools should have in place protocols to basically try to mitigate transmission. So all students and teachers should be wearing masks. There should be the practicing of social distancing. There should be good hand hygiene. Individuals really should be cohorted or potted, so it's the same small group of students and teachers that are together in a setting. They really should have in place protocols so that they really try to, not use lockers, not use break rooms, eat their lunch in their rooms to prevent mixing of multiple large groups of individuals. The same with recess and other classes. They really should be staggered so that you don't have such a large group of individuals in the same place at the same time, because all of that increases the risk of transmission of COVID if somebody's infected.
Yeah, absolutely. And I think, just from a school operation perspective, those cohorts of trying to keep people in small groups is incredibly important as we start to try to do contact tracing, right? Assuming that it's inevitable that someone will have COVID-like illness, whether or not they ultimately test positive. And we're going to need to be thinking about who they've been in contact with at home and in the school building. And if they have been wandering around the school building in contact with everyone, then we really have a hard time trying to figure out how to separate out those who have been exposed and how to pull them out if warranted based on the students' test results or their symptoms. So those cohorts are really challenging for schools, though, because of the lots of the ways that schools are set up. There's lots of mixing of cohorts, both for instructional purposes and for recreational purposes. And I think that does throw a little bit of a monkey wrench into planning and operations, and schools are really wrestling with that.
Yeah, they're definitely grappling with that now. You guys touched on the different kinds of protocols that students should take, the face masks, the hand washing, social distancing. Any other maybe screening process or protocols that school districts should be doing when they open their doors?
Yeah, there really should be a protocol in place for symptom screening before the child goes to school, because you don't want to send a sick child to school. So if a child does have, it may not be fever, but it may be other symptoms, they probably should stay home until they can be evaluated. Because I think once we start not screening and sending sick people to school, there is going to be an increased risk of the transmission of COVID in those situations.
Yeah, I think one of our great challenges is to communicate to parents and caregivers that this is the year. If you previously thought that maybe a few sniffles was good for your child's immune system, or probably was nothing, or it might have been their allergies, this is the year in which we really need you to err on the side of caution and keep your child home. COVID-like illness manifests in lots of different ways, and a lot of it is really nonspecific. So it could masquerade as lots of different things. So unless you've gone to a healthcare provider and they've said to you, no, I feel totally comfortable that this is your child's asthma or their allergies, for example, then if your child is ill or even just a little out of sorts, I would always err on suggesting that parents and caregivers, and the same for teachers, stay home.
Correct.
So what action should a campus take if a student or a staff member appears to be symptomatic? You mentioned asthma, so maybe somebody's having difficulty breathing, or worst case scenario, they actually test positive for COVID-19. What action should a campus take?
So there should be a protocol in place before the school opens to determine what needs to be done if somebody tests positive. And they really need to also work with the public health department if someone tests positive, because contact tracing becomes a major part of this to determine how many people the student potentially was in contact with, how many families might have been in contact with the student, so that, that's where the cohorting really comes into play, because you're not talking about trying to test the whole school, but you're talking about really trying to test those individuals that are in the separate cohorts. And I think Dr. Johnson might be able to elaborate on this more.
I think following up on that, I think one of the things that we're going to see is that different districts and different schools are going to react differently to COVID-like illness or to tests based on how good their public health mitigation efforts are in the building and what guidance they're getting from their public health agencies. So it's conceivable that some schools and districts will decide, if their kids are really well cohorted and that they're sitting 6 feet apart and everybody is really well masked and they have lots of separation and they have good ventilation, lots of these things that we know of as being incredibly important from a public health mitigation standpoint, that they might feel more comfortable allowing people to remain in school Even if someone does have exposure to brief exposure from 6 feet apart with a mask, all of those caveats in place, they may be allowing them to remain in school. There are other places where their public health agencies are really going to recommend that anybody who has been in close contact with someone who has either COVID-like illness or a positive test, so that's being within 6 feet of someone for 15 minutes or more, they're going to recommend that they pull that whole pod or cohort out until either the time of incubation has passed or that the individual has a negative test. So there are lots of logistical questions that are going to happen, and that's a really tight relationship between what's happening in the building to try to reduce transmission from person to person and the prevalence of the illness in the building.
Mm-hmm.
Yeah, I think the most important thing, though, is that there needs to be a good relationship with the public health department if something like this occurs, so that the appropriate contact tracing can happen.
Right. So what kind of community rates of, infection or within just a campus or a school should lead a campus to close that school or to reopen it once it's been closed?
I think that is a rate that is really going to differ depending upon what school district the school is in, what state the school is in, et cetera. Again, you want rates in the community to be low. The school that you brought up regarding 900 students and faculty that had to be quarantined because in that situation, the school was requiring faculty to wear masks and were not requiring the students to wear masks. And they were actually they weren't cohorting, so all the students were actually mixing and mingling with other classmates. So there were a lot of individuals that were not social distancing, they weren't wearing masks, and there wasn't any hand hygiene, and this really led to the outbreak and the closure of that school. So I think in that situation, you're going to have to see what happens after the quarantine period, whether other individuals are positive, to determine whether or not that school is going to be safe to reopen. And in that particular community, the rates of infection in the community are actually quite high. So probably was not the best idea for that school to open at this point in time.
I don't think that there's a magic number that it's one case or 2 cases or 10 cases. I think, as Dr. Tan is mentioning, there's lots of things that go into whether or not it's time to close a school. I think one of the considerations above and beyond transmission risk is supervision, right? If we have faculty members and adults in the building who are no longer there, questions remain about who's going to teach and who's going to monitor kids. And who's going to come to school if lots of kids are quarantined. So I think there's operational issues as well as viral transmission issues in terms of when.
I think the other thing is that in those situations, those schools really need to enhance their mitigation protocols to prevent transmission. So, I think that was one of the major factors that led to this occurring, is not requiring students to social distance and not requiring them to wear a mask. And I think this really led to the spread of the virus in the school.
So I know data is still coming in on, the ability for students to get sick, how sick they get, things like that. So should all elementary school students be wearing, face masks throughout the day? Do face shields suffice? And kind of like, what about the youngest learners, pre-K students, special needs students?
So I think the major thing to remember is that anybody can get COVID. We know that when kids get COVID, the majority of them either don't have any symptoms or have mild symptoms, but they're still able to transmit COVID to other individuals. Now, studies have shown that children under 10 years of age probably don't transmit as effectively as those over 10 years of age, but they're still able to transmit the disease. So kids that are going to be in the school setting, they really should be wearing a face mask, and they should be social distancing and practicing good hand hygiene. If teachers want to wear face shields actually work quite well in that they protect your eyes, your nose, and your mouth, as long as the face shield goes below your chin. There are some people that sort of double up and they wear a mask and a face shield, but you actually don't need to wear both. You can wear one or the other. And in cases of special needs students or younger kids actually that need to see the face of a person or that need to see the mouth of a person, a face shield, a clear face shield probably works better with regards to trying to teach these children or teach special needs children.
Yeah, I would say that in a school building, anyone who can mask should, and from a developmental perspective, that's down to about 2. So there are reasons, as Dr. Tan mentioned, developmental and other health conditions that may impact individuals' ability to wear a mask, but they're actually a relatively small fraction of the total population. And if everybody else is really doing a great job with their masking or mask and face shield, whatever their choice is, we can really make a pretty big dent in this. There are also some masks that are made for children who are hard of hearing, or for example, during teaching reading, where seeing the mouth is really important for phonemic awareness. They have little plastic panels, clear plastic panels in them so that you can see the speaker a little bit better. So those have been some things that districts are considering.
Okay. So we talked kind of about, what students should be doing, social distancing, the face masks, but what should school districts be doing, or how much should they be spending on things like disinfecting the schools, HVAC systems, things like that?
So some of it it's going to differ depending upon the school district, and there's not a magic number. You want to have adequate hand sanitizer available for everybody in the school. The school really should have some type of protocol in place as to how frequently touched surfaces are disinfected and wiped down. At the end of the day, absolutely, the school needs to be cleaned. Every single surface needs to be cleaned. Bathrooms especially need to be cleaned, and there probably should be a protocol as to how frequently the bathrooms are cleaned during the daytime. But in terms of a monetary number, there is no magic monetary number. It's going to depend upon the school district and the schools themselves. Now, HVAC systems, again, there are many schools that don't have air conditioning. And then they need to work on trying to increase ventilation in the room, because we know in poorly ventilated rooms that have a number of people in it, it's much easier to transmit COVID. In those schools that do have air conditioning, they probably should be looking into putting in HEPA filters in order to basically filter the air a little bit better. But good ventilation, no matter how you do it, is going to be key in trying to prevent the spread and transmission of COVID in the classroom setting.
I agree. And I think, just following up on the question around how much money do we need to throw at this problem, I think one of the challenges there is that we see the potential for the pandemic in general to really exacerbate existing inequalities between schools that have a lot of per pupil resources and those that don't. And so I think we need to really be thinking about what is it going to take for every school district to bring students back in the way that students deserve to be brought back, which is with the appropriate cleaning supplies and cleaning protocols and PPE, all of those things in place. So as we think about how much it's going to take, it's probably going to take more for schools that have aging infrastructure and other challenges at baseline than some of the places that have state-of-the-art facilities and new HVAC systems and air handling and all of that. So thinking about equity, I think here is really central.
What about things like outdoors, playscapes? Is it okay for students to be on them? I know one district in this area was going to rope off their playscapes because they don't feel like they have the ability to wipe it down between every student use.
Yeah, I mean, again, that's going to be school dependent, but if a school is telling you that they don't have the ability to basically clean in between, one class using it and the next class using it, then it's probably a smart idea to not use it at this time until they can build into their schedule a way of cleaning in between classes using the playscapes.
Yeah, and I think when we're talking about outdoor play structures, there are probably ways to make that cleaning relatively straightforward, right? We're just talking about high touch surfaces, shared surfaces, right. Not scrubbing every part of the playground equipment. We're less worried about fomite transmission now than we might have been at the very beginning of the pandemic. So I think that's important. I also think that trying to get kids to use sanitizer before and after, all of those things can help. Trying to get kids outside is going to be hugely important as we ask them to do things like wear a mask and try to do less wandering around the building. All of those opportunities to get outside are going to be really important to their ability to comply.
Mm-hmm.
Yeah, I mean, you can hold classes outside. That would be another way of doing it, just so that you have more room to social distance and the kids don't feel so cooped up in a classroom.
Right. What do you anticipate the fall will look like later on in the fall when the weather turns cooler and cold in some places? Typically, you see more kinds of infections, colds, flus, things like that. So what might the fall in the school year look like at that time with COVID?
I think one thing that's going to be crucial now, is that everybody is up to date on their routine immunizations, and everybody should get an influenza vaccine. Influenza definitely is going to emerge in the fall, as it does every single year. We still will have COVID. And if individuals are not up to date on their immunizations, you could also have outbreaks of vaccine preventable diseases. So I think it's going to be really important that everybody be immunized against these diseases, as well as get a flu vaccine to try and decrease the amount of potential infections that these children can have during the fall.
Absolutely. I mean, the burden of flu is so large in our communities during the fall and winter months anyway. You don't want to be ill with the flu and need to go to the hospital to seek care, inpatient or outpatient, if you don't have to. So another plug for getting your flu vaccine for yourself, for your kids.
Okay. Yep. Before I turn it over to Sarah to have our EWA members ask you their own questions, you are addressing a group of journalists across the country. And so I'm just wondering, from your perspective, what stories do you think that we should be examining? What should we be covering? What issues around the reopening of schools and COVID should we be writing about?
I think what's going to be really important is to put out information that individuals can use to really determine whether or not a school should be open. So, I think there should be very factual things that are put out there about, don't open a school if the community COVID infection rates are high. Schools should really have mitigation protocols in place to protect both the students as well as the teachers. And that includes, protocols for sanitizing frequently touched surfaces, protocols as to what to do if somebody were to test positive. There should be good relationships with the public health department for contact tracing. I think, and as well as symptom protocols before the student goes to school. But I think it's really important because I think there's just a lot of information out there. But I think if you just have, the facts about what needs to go into opening a school safely, I think that can go a very long way.
I totally agree with that. And I would say that one area that I think has received less attention, but is going to become increasingly important as we send kids back to school, is school-based healthcare. We know that there's a systematic shortage of school nurses in this country. About 25% of schools in the United States have no school nurse, and about 35% have a part-time school nurse. So as we think about who's the person on the ground who's going to be evaluating whether or not kids need to be pulled out of school because of a specific set of symptoms, or who are going to be reviewing screening logs, or who are going to be answering questions from folks who are really have valid concerns about their health and well-being or those of their families, it's going to be school nurses who are on the front lines. And that's a place where we have systematically underinvested for a really, really long time. So thinking about how we support school nursing and school-based health services in general is really an important next step to this, because this is going to be with us for a while. It's not going to go away this winter.
Right.
Yeah, I think the other thing that's important to address too is some of the disparities that we see with regards to the different school systems. So children that are maybe of different, racial ethnicities that are in underfunded school systems, they're not going to be able to benefit from the school nurses as well as some of the other things that were discussed. And I think this is something that really needs to be brought to the forefront so that these kids and teachers actually are safe when they go to school.
And what advice would you give to campuses opening and to parents who are considering sending their kids back?
I would say that you should be asking the school district about all the things that we talked about. Is there a protocol in place for symptom screening? Are there other mitigation protocols in place in the school setting? Are you going to be cohorting the students and the teachers? Are you staggering stop and start times for the different classes? Are you doing a hybrid model? Are you doing, several days in-person learning and several days virtual learning? Is there a protocol in place for what happens if somebody tests positive? I think parents really need to know all this information in order to make a decision as to whether or not they would like their children to go back to in-person learning.
Totally agree.
Great. Well, I'm going to pass it back on to Sarah so that some of our EWA members can ask their own questions of you guys.
All right, let's go ahead and get started. Our first question comes from Lauren Camera of the U.S. News. Her question is, what's the impact of the current messaging coming from the White House that schools should reopen in person since children rarely get infected, they aren't super spreaders, and they don't get sick from the virus? How concerned are you about this messaging?
So there are parts of that message that are completely incorrect. We know that anyone can get infected with COVID. Yes, the majority of children either have mild symptoms or don't have symptoms, but they are still able to spread the virus. And there is a small subset of children that can actually go on and develop the multi-system inflammatory syndrome in children, also known as MIS-C, where these children actually get very, very ill. This is a life-threatening, serious infection that they can get associated with them having COVID, where they can actually have symptoms that mimic either Kawasaki disease or Kawasaki shock syndrome or toxic shock syndrome, and they end up in an intensive care unit setting and are quite ill. So kids can become quite ill after having COVID disease.
I think that messaging around COVID is incredibly important because the science is evolving and what we know and understand changes all the time. And I think it's incredibly important to communicate clearly that those changes are not as a result of people not being interested in sending kids back to school. They are our efforts to use and understand new data as they come in and to inform the opening process. So clear communication that's scientifically and factually based, that's clearly communicated to parents without favor is incredibly important. And I don't think that the federal government's efforts in that regard have been helpful to us in getting out a clear set of public health guidance. I would also just reflect on the fact that so much of opening schools, as we've talked about throughout this discussion, depend on what's happening in communities. And we cannot decouple what's happening in communities in terms of rates of transmission from what's going to happen inside the school buildings, because kids go home to parents and grandparents, and teachers come home to parents and grandparents and children. So these are not islands. And so when we're talking about kids don't get sick, we are also talking about communities of multi-generations, and people do get sick in very different ways depending on their age.
All right, thank you. Our next question comes from Megan Mangrum of the Tennessean. And her question is, how should districts communicate with parents or community members about cases in schools? Should they release this information publicly or inform all families of students in that school, or just those who are possibly exposed?
So again, it's something that Dr. Johnson and I have been talking about, and that it would be really important to have children and teachers cohorted so that you have fewer number of individuals that need to be tested or placed in quarantine, as opposed to if you don't do that and you have a lot of mixing of large numbers of students and teachers, you run the risk of having to close the school. So simply with the messaging, if someone in a classroom where you have cohorting tests positive, then you can send out communication to the parents of the students that are in those classes, primarily because they need to know, one, and there may be siblings that may also need to be quarantined given that they are exposed to the student that tests positive. But it sort of is going to depend upon what the structure is of whether or not you're cohorting your students and teachers or whether you're not. Probably you don't need to send it out to the entire school if the other classes are going to continue to be held. But that is up to the school district and the school itself.
I think a communication plan is really important, and I agree that there are lots of ways that that can happen. I think it's also important to remind parents that those communications probably don't tell us all that much about the burden of COVID-19 in our schools necessarily, because so many children will be asymptomatic. And in the vast majority of communities, you're not going to have surveillance testing. You're simply going to be testing based on whether or not somebody has an exposure or has symptoms. So we have to put those processes in place to assume that anybody could be positive and to reduce the likelihood that if someone is asymptomatic and is in a classroom, that they're going to transmit it to someone else. So it's important to have a clear communication plan in the case that someone does have a positive test. But I don't think we should be using that as the indicator of risk inside the school. We should be thinking about how we drive down community rates of transmission so we're not having a lot of asymptomatic cases.
All right, our next question comes from John Newsom of the News and Record. Colleges and universities across the country have reported numerous COVID cases over the summer after athletes and a few others came back to campus. How worried should residential colleges and universities be about outbreaks when the entire student body returns to campus this month?
Well, I can jump in on that one only because I'm a parent of a new college freshman who's leaving for college on Saturday, and so this has been a conversation in our own household. But I think that again, the theme of our conversation today is it depends. The colleges, small residential colleges, are probably a very different situation than large commuter schools, right? You're going to have more or less mixing, regardless. The same way that K-12 education needs to be thinking about mitigation, our colleges and universities need to be thinking about that. I think we have more challenges because college students have many more contacts and have more mixing among them, and how you enforce that is an ongoing challenge. But there are colleges around the country who have really grappled with this in terms of trying to quarantine, to do testing procedures, to cohort, to have classes outside. So I think that's also potentially a solvable problem, but it won't happen on its own. You will need to have all the same careful, thoughtful public health mitigation messages in there. But as a parent, my kid is going, so tells you something about my faith in the public health interventions that we can and should have in place.
Well, I completely agree with Dr. Johnson. I think that, as long as there are mitigation protocols in place, I think it's a much safer place to be. But again, with college students, as Dr. Johnson mentioned, it's going to be a little bit harder to police them than to police the younger kids. And one thing is that you don't want to put too much confidence in someone who is screened negative just because some of those tests are not the most sensitive, and these individuals could be in an incubation period where they test negative at that one point in time and then later on would test positive. So there has to be a number of different mitigation protocols in place in order to, make college the safest place for these individuals.
Our next question comes from Kim Case. How close are we to increasing testing capacity so that teachers can get tested weekly? Would that be effective?
That would be a lot of resources, and I'm not aware of anywhere that has the resources to be able to do that. I mean, maybe Dr. Johnson has more insight into this, but I'm not aware of any institution that has the resources to be able to test on that frequency.
Yeah, I think that would be a very unusual situation that we would have that kind of capacity for surveillance testing or for routine asymptomatic testing. I think there's no doubt that we need to increase capacity for testing, and in the same way that we need to increase capacity, the related concern is that we need to try to make the turnaround times for tests as short as possible. And as we see the capacity strain on testing resources across the country, we've seen the lag times from test to results get longer and longer. And of course, once those test lags get really long, they're not that useful because people have gone out and essentially had another life between the time they get tested and the time they get their results. So I guess if I were going to choose the way that we use our resources, I would focus on shortening lags for people who have indicated reasons for getting tested rather than necessarily testing everyone routinely. If we had the capacity, it would be great, but I don't know that it exists at this point.
All right, our next question is from Jen Smith. Are children more at risk sitting at forward-facing desks at 3 feet apart or facing each other at opposite ends of 6-foot-long conference or lab tables? Any other recommendations on how classrooms should be set up to mitigate transmission?
So most of the classrooms really should be set up so that all the desks are facing in the same direction. There's less likelihood of transmitting that way. The desks can be anywhere from 3 to 6 feet apart, but obviously the further apart the desks are, the better. And students should be wearing masks and practicing good hand hygiene, as well as the teachers should be doing the same thing. in order to decrease the potential spread of COVID.
Agreed.
All right, our next question is from Jill Barchet. What are your thoughts on how schools can enforce proper mask wearing?
I think that one thing that we have learned from a sort of developmental standpoint and from a social science standpoint is that mask wearing can be normative, and it just doesn't need to be that big of a deal. So from the time kids enter school when they're in pre-kindergarten or even in some local preschools, kids are happily wearing masks. They can decorate them, they can be taught to use them, they can watch videos about how to use them. I think when you are a kid and you watch those around you wearing masks, you see your parents or caregivers wearing masks, it just becomes part of the landscape and no longer a real source of frustration. So I think kids who get used to wearing masks can. We have slightly different concerns when it comes to adolescents. And I think that one of the opportunities for adolescents is that they understand that they can be part of this. And I think bringing teens and young adults into the fray when we say everybody needs to be masked because we need to be able to protect the community, we need to be able to protect people in our families who can't protect themselves in the ways that we might hope. I think those strategies can be effective, but most importantly, if everybody's wearing a mask, I think it's just a non-issue. It becomes an issue when there's huge variation and it is sort of an ideological statement. This is not an ideological statement. It's simply a public health device to reduce the risk of infection. That's it.
All right, our next question comes from Cassandra West of Crane Chicago Business. Do you see a new relationship developing between public health officials and school districts? And what recommendations do you have to make sure the relationship works best for everyone?
That's a tough one. There are many school districts that probably there's not a public health department oversight for, especially in some of the more rural areas of the U.S. But, I think that the public health department is there to help the school districts, and the school districts really need to reach out to the public health department with questions or other, issues that they have to let the public health department help them solve them. But, there should be good communication between the school district and the public health department in the different areas of the U.S.
I think this is such an important question in the ways that we can promote really productive partnerships between public health agencies and education. And I think, the backdrop of this is that public health agencies are historically underfunded, but now are totally overwhelmed with the enormity of this task. So they are stretched thin and everyone is working at their full capacity at the same time as educators are stretched thin and working at their full capacity. And so I think the opportunities are really not only to work in concert with the local public health agency that governs your district, but also to try to look around the country for resources that have been developed sort of for some of these kinds of things that we're talking about today, that so you don't have to reinvent the wheel. And then to talk to your public health agency about how do the conditions on the ground here in my specific area help me interpret these guidelines differently. But I think open communication and some kind of routine face-to-face or virtual face-to-face meeting is really important, so that there can be clear boundaries between who's going to do what and at what points and about what do we need to communicate so that everybody's on the same page. Back to that sort of clear and consistent communication that helps everyone understand what's going to happen.
All right, our next question is from Eric Weddle of WFYI in Indianapolis. Schools are already opening in Indiana. In the past 2 weeks, school districts and counties have already reversed decisions for in-person and virtual only classes. What questions should we ask these officials to explain why they changed position for how schools open? So much of the conversation here is focused solely on local county infection rates. What other metrics should we look at?
I mean, that is going to be the major metric that should factor into the decision as to whether you go back to in-person school is what the infection rate is in the community that the school district is located in. Because that's really going to have a major impact as to the potential for transmission and spread of COVID in the school setting, since people are coming in from the community to basically attend school. And it's not just the students, but it's also the teachers, and then they go home back into the community. So it's going to be really important that, you know, they factor into whether or not in-person school happens, what the community rate of COVID is.
And every school and district should have a set of metrics that they're monitoring, not only around community spread and case rates, but also they should have a series of data that they're really monitoring at the school and district level that tells you about how things are going. So the kinds of things that you might want to know is how many people are failing screening when they come to school, how many kids are getting sent home for COVID-like illness or for other non-specific reasons, how many kids are coming to school when they're enrolled in in-person learning, and then absenteeism. I think absenteeism, both for staff and for kids, is going to be a leading indicator of how things are going. It doesn't mean that everybody who doesn't come to school has COVID, but what it does tell us is something about the confidence of individuals in sending their kids to school, as well as the opportunity for adults in the building to be able to do their jobs in supervising kids. So I think that every school and district is going to have to come up with a set of metrics that they monitor really carefully and get their arms around how to do that in an effective, ongoing way. Because again, this is something we're going to be monitoring for a while.
I mean, the other thing to consider also is for virtual learning, the school really has to have in place a way of providing computer access and internet access to some of those children that are more disadvantaged. And, you know, they really have to have a protocol in place so that these kids don't get so far behind with regards to their education. So that is another factor that really needs to be taken into consideration.
Our next question comes from Marisa Nicosia, who is an independent journalist in New York. Knowing that the nurse to student ratio is very low in many districts and schools are facing budget cuts, what are your thoughts on the possibility of partnerships between school nurses and community public health workers who could supplement care in school buildings?
I think this is a tricky issue because in our country right now, many school nurses are employed by lots of different entities across the country. Some are employed by schools and school districts, some are employed by public health agencies and health departments, some are employed by university health systems or other medical centers. So there's lots of different ways that people can be employed as a school nurse or as a health aide. And many of the individuals who are employed by public health agencies have been redeployed to take care of the public health mission. So that's further straining the capacity that we see among school nurses who are employed by public health agencies. I think so the question around to what extent can we use community public health workers to help with this? I think we're going to need all hands on deck when it comes to capable, thoughtful, well-trained individuals who are ready to help and pitch in. But I also think that they are going to be taxed as well because they're going to be needed in terms of contact tracing or other kinds of key public health functions that we're having difficulty keeping up with.
I completely agree. Right now, everybody is really stressed to the max. And, you know, I think if you think outside the box a little bit, you might be able to find other individuals that can contribute to things that the school nurses and the public health officials would be doing. But right now, I don't know if you can rely upon the public health department to sort of take up the slack for the school nurses because they are also tasked with a lot of other things.
Our next question comes from Charles Lussier. What are the best lessons to draw from other countries where schools have been in operation during the pandemic?
Drive transmission down to near zero. That's the, I mean, I think that when we look across the world, most of our international peers have been more successful in getting community transmission rates to be quite low before they've opened. So it's a totally different landscape for them than it is for us. That's not uniformly true, but I think we are the exception globally in having persistently high rates of transmission, and also in our lack of sort of focus on that as a prerequisite for opening schools or for opening schools in places with high transmission. So I would say we're exceptional, but maybe not in a good way.
I mean, the other thing too is if you look at schools abroad, there have been outbreaks in those settings where transmission mitigation protocols were not followed. So individuals not wearing masks, not doing social distancing, not having good hand hygiene, there have been outbreaks in those settings. But I agree with Dr. Johnson, one of the major things that needs to be considered has to be community transmission rates.
All right, we have time for a few more. Our next question comes from Swayvon Lee of the Honolulu Civil Beat. In my state, not every kid goes to their district school. Some schools host as many as 40% of kids who live outside the district. What safety protocol advice would you give to those schools that are hosting kids from various geographic areas where the rate of community infection will be disparate?
Yeah, I mean, I think in those situations, it is going to be incredibly important that the school have in place mitigation protocols, you know, as we've been talking about. So everybody wears a mask, everybody symptom screens before going to school. There's social distancing in place. There's good ventilation in the rooms. There's good hand hygiene. All those things can really go a very long way in preventing transmission and spread of COVID in those types of school settings. Because obviously you're not going to be able to control who's going to go to those schools and from which communities, where you can have differences in terms of transmission rates and community infection rates.
Absolutely. I think that it's really common throughout the US for various schools to have a much broader catchment than the neighborhood school model. That's particularly true, I think, in high schools where there's a much larger catchment. And I think the related question is, how are those kids getting to school? So in many communities, that's a bus, but that's not also uniformly true. In some communities, that's public transportation. So if we're asking people to be riding public transportation across the city, traversing communities with varying levels of spread and then arriving at school, we have to be sort of keeping in mind the fact that we are at that point one bubble. We have a lot of mixing going on. So I think it's a really important consideration both for Hawaii and for other communities around the country.
All right, our last question is from Dave Martins of the York Dispatch. Might you provide a link to best practices for making this critical decision? You don't have to provide links right now, but perhaps you could end by offering some suggestions of resources that you would suggest journalists go to on what the recommendations are. So what do you guys look at when you are looking for recommendations?
So I think the CDC guidance for reopening of schools and the updated guidance is actually a very good document. Also, the American Academy of Pediatrics put out guidance for reopening of schools and sort of goes into a step-by-step protocol as to what needs to be in place for the different ages of students. So they basically start at pre-K and they go up. They talk about what needs to be done in terms of kids that have some sort of learning disability, or, you know, what happens with older teachers, etc. And I think that is also a very, very good document to go to get some basic understanding as to why these types of protocols were put forth.
Yeah, I agree. Those are two that I think are really evidence-based and useful.
All right, well, thank you, Dr. Johnson and Dr. Tan, for answering all of our questions. Thank you, attendees, for joining us. There were so many more questions that I didn't get to, so I apologize if I didn't get to your question. And thank you, Melissa, for moderating our conversation today. As soon as the webinar closes, you will see an evaluation survey. Please complete it. Your feedback is important and it helps us improve. Finally, you can visit ewa.org/events to sign up for our upcoming virtual seminars and webinars. Thank you to everyone and have a great day.